1. A key responsibility of a certified provider credentialing specialist is to ensure compliance with which primary regulatory body's credentialing standards? A. Federal Trade Commission. B. National Committee for Quality Assurance. C. Department of Education. D. Internal Revenue Service. 2. When developing training for credentialing staff, which adult learning principle is most important to consider? A. Adults prefer passive listening. B. Adults are self-directed learners. C. Adults require rote memorization. D. Adults learn best through repetition only. 3. Which method is best suited for evaluating the effectiveness of a provider orientation curriculum? A. Pre- and post-tests measuring knowledge gained. B. Counting the number of providers attending. C. Reviewing only regulatory documents. D. Observing staff interactions in unrelated meetings. 4. In mentoring new credentialing specialists, what strategy most effectively promotes long-term skill retention? A. Providing checklists without explanation. B. Encouraging reflective practice and feedback. C. Assigning only clerical tasks. D. Limiting opportunities for problem solving. 5. Which document is most critical when verifying a physician's eligibility for credentialing? A. Tax returns. B. Curriculum vitae. C. Primary source verification of licensure. D. Personal reference letters. 6. During a training session on regulatory compliance, which approach aligns best with adult learning theory? A. Delivering a lengthy lecture with no interaction. B. Using case studies of compliance issues. C. Reading directly from a policy manual. D. Having participants memorize statutes verbatim. 7. The most appropriate evaluation method to assess communication skills in a credentialing specialist is A. Multiple choice exam. B. Role-playing scenarios. C. Counting the number of calls made. D. Reviewing expense reports. 8. Which federal law requires healthcare organizations to report certain adverse actions against providers? B. EMTALA. C. The Civil Rights Act. D. Healthcare Quality Improvement Act. 9. When designing a continuing education module for credentialing staff, which factor is most essential? A. Entertainment value. B. Learner readiness and relevance. C. Use of complex jargon. D. Minimal learner engagement. 10. What is the primary purpose of ongoing provider performance evaluation in credentialing? A. Increase patient billing. E. Ensure quality and safety of care. C. Reduce administrative paperwork. D. Eliminate provider autonomy. 11. A mentor notices a trainee repeatedly entering data incorrectly. The most effective response is A. Publicly pointing out every error. B. Providing constructive feedback and coaching. C. Ignoring mistakes until performance reviews. D. Assigning unrelated tasks. 12. Which organizations set standards for accreditation that impact credentialing processes in hospitals? A. Joint Commission. B. OSHA. C. Food and Drug Administration. D. Department of Defense. 13. When evaluating a new communication protocol, the most valid measurement of success is A. Number of emails sent. B. Provider satisfaction with response clarity. C. Hours spent drafting emails. D. Page length of messages. 14. Which adult learning technique best supports credentialing specialists learning complex software systems? A. Interactive simulations and practice. E. Long theoretical lectures. C. Independent reading assignments only. D. Memorizing key terms without context. 15. Regulatory compliance in credentialing ensures. A. Staff receive bonuses. B. Providers meet required legal standards. C. Increased social media presence. D. Reduced annual audits. 16. Which mentoring technique encourages critical thinking? A. Asking open-ended questions about real cases. B. Providing all the answers immediately. C. Avoiding questions during discussions. D. Encouraging rote memorization. 17. What is the first step in primary source verification for credentialing? A. Contact the provider's references. B. Verify licenses with issuing boards. C. Review provider's tax records. D. Ask provider to submit a self-attestation. 18. A post-training evaluation shows staff did not retain information. What should be revised? A. The entire compliance policy. B. Instructional strategies and methods. C. Provider performance metrics. D. Payroll documentation. 19. The best way to ensure credentialing policies align with regulations is to A. Conduct regular audits and reviews. B. Rely on provider self-reports. C. Limit policy review to once every decade. D. Assign compliance tasks randomly. 20. When mentoring, modeling professional behavior is most closely tied to A. Imitative learning. B. Passive instruction. C. Memorization drills. D. Administrative delegation. 21. A credentialing specialist is preparing a training manual. To support adult learners, the manual should A. Contain only long paragraphs of text. B. Incorporate real-world examples and scenarios. C. Use technical jargon exclusively. D. Exclude self-assessment opportunities. 22. Which evaluation method ensures a provider's continuing competence? A. Peer review and ongoing performance monitoring. B. Self-reported satisfaction surveys. C. Reviewing billing claims only. D. Collecting attendance records. 23. The most effective communication strategy for resolving provider disputes during credentialing is A. Active listening and collaborative problem solving. B. Avoiding communication until conflict subsides. C. Sending automated template responses only. D. Escalating immediately without discussion. 24. What federal law governs patient privacy and impacts credentialing record handling? A. HIPAA. B. ADA. C. ERISA. D. FMLA. 25. In curriculum development for credentialing staff, measurable learning objectives are essential because they A. Ensure content aligns with accreditation standards. B. Increase the number of staff enrolled. C. Limit administrative expenses. D. Simplify payroll processing. 26. When mentoring a new staff member, scaffolding refers to A. Removing support immediately. B. Gradually reducing assistance as competence grows. C. Assigning unrelated tasks as practice. D. Limiting opportunities for questions. 27. To evaluate training effectiveness objectively, a credentialing manager should A. Track pre- and post-training performance data. B. Rely solely on trainer opinion. C. Measure attendance only. D. Count printed manuals. 28. Which communication approach builds trust with providers during credentialing? A. Transparency and timely updates. B. Avoidance of difficult topics. C. Excessive technical jargon. D. Minimal interaction. 29. A credentialing specialist is asked to verify malpractice history. Which source is most appropriate? A national practitioner databank. B. Provider's self-reported CV. C. Provider's tax documents. D. Local newspaper archives. 30. Which adult learning principle supports including self-assessment quizzes in training? A. Learners value immediate application of knowledge. B. Adults prefer passive content absorption. C. Adults avoid testing altogether. D. Self-assessment hinders retention. 31. Mentoring in credentialing focuses primarily on A. Professional growth and competence. B. Social relationships. C. Entertainment and relaxation. D. Reducing compliance monitoring. 32. A credentialing audit reveals inconsistencies in provider files. The first corrective step is A. Develop a remediation plan and staff training. B. Discard all existing records. C. Delay action until next year's audit. D. Assign blame to providers. 33. Which communication strategy best reduces misunderstandings with physicians? A. Clarifying expectations in writing. B. Using vague terminology. C. Limiting conversations to phone calls. D. Avoiding confirmation of agreements.